Mount Sinai School of Medicine for some answers.
I want to talk about the 11 million vaccine doses that will start to be shipped out starting next week. How much of a game changer will this increase be?
President Biden has laid a comprehensive national strategy to increase the vaccine availables, and number one priority was working with manufacturers. Now, looking at what we're going to have available from next week, 11 million doses actually means a 30% increase from late January. And that would allow us to vaccinate 1.5 million people daily. In that case, we could have, in 100 days, half of the U.S. population vaccinated.
So since the start of this vaccine rollout, we've been hearing a lot about manufacturing issues, logistical issues. So how is the Biden administration able to come up with this 2 million increase seemingly overnight?
It really didn't happen overnight. It was a progressive increase over the last 3 weeks. The newly assigned COVID team works very aggressively on this, and invoking the Defense Production Act allowed two things. One, allows manufacturers to purchase more machines for production, also to have more access to raw materials. But second, allows the government to have a big eye where the gaps in manufacturing are so they can address it at the federal level. A smaller factor was that now Pfizer officially is accounting for the 6th dose that before was not counted. You know, at the beginning we had only 5 doses per vial and extra leftovers. Now they're officially making 6.
Another issue that we've been hearing a lot, many Americans still struggling to find available appointments. So does this increase mean that it will be easier for those eligible Americans to get the vaccine? And will states be able to then enlarge that pool of people that are eligible for a vaccine?
There's definitely a huge improvement in the vaccination rollout. We're seeing a lot of steams with the new stimulus budget that was implemented. We see a lot of vaccination centers, a lot of people being hired. But the bottom line is if we can catch up with the supply and have 1.5 million, as I said earlier, vaccinated daily, that would be incredible. Plus, a lot of these new doses will be allocated to those hardly hit communities, the minorities, the brown and black people who have less access to healthcare in general.
All right, so let's look ahead now. Can we expect similar ramp-ups in these next coming weeks?
I expect there are more kinks that could be looked to improve the vaccine supply chain at this point. But to see a significant jump in production, it takes about 6 months. I mean, manufacturers have to buy new equipment, to train a new workforce, and to have access to more raw materials. So that takes time. So I would say really a big jump will be visible in 6 months.
All right, thank you.
Thank you.